And for our webinar this month, we are talking about examining rural traffic safety culture and Appalachia case study. I'm going to go ahead and close out these polls around the outside and broadcast the results for you. It looks like we have about 12% of people joining us from the Northeast, about 31% from the Southeast, about 26% from the Midwest, 30% from the West, and about 4% other. As far as how many people are joining us, most of you are joining us by yourself. As always, it does look like we have a few groups, so I would ask you if you could please send us a list of participants and email addresses to info@ruralsafetycenter.org. We will make sure to get the survey out to you guys so that you can apply for CEUs if that's something you would like to do. As far as where everyone is joining us, what type of organizations you're joining us from today, it looks like we have about 7% federal transportation departments, about 23% state transportation departments, about 20% local, about 3% state highway safety office. We also have about 7% of local technical assistance programs, 7% other federal, state, or local government agencies, 17% from universities, and about 10% from consultants and 7% from other. Most of you are joining us by the computer only, like usual, but I would remind you that if you do have any audio issues for today's webinar, as always, you can put those into the chat pod, but the first thing we would ask you to do is try calling in on our phone line if you do have those audio issues. The phone number can be found in the top left-hand corner of your screen. At this point, I am going to move us over to our presentation so we can begin. We do have just a few webinar logistics for you. Our webinar is an hour-and-a-half long. It is being recorded, as always, and will be archived on our website. For quality of our recording, we have muted everyone for the presentation. Because of this, we will ask you to put any questions that you may have in the chat pod, which you can find on the left-hand side. If you are listening by phone, or if you do have audio issues and end up calling in, please make sure that you mute your computer. Otherwise, you will have some feedback that you'll hear. If you would like to see the presentation itself full screen, there will be quite a few graphics that will be shown today and figures. You can use those 4 arrows that press outward up in the right-hand corner of your screen. That will get rid of all the extraneous information along the outside of your webinar screen and make just the PowerPoint full screen. At the end of each section, of which there will be 4 today, there will be time for question and answer. Again, you can feel free to put those questions in the chat pod at any time. You don't need to wait until we get to a question section break. I will read each of those questions out to our presenter at the time. There's also a handout pod in the bottom left-hand corner of our screen where you can find a copy of today's PowerPoint slides. And then I do just want to remind you to please do the follow-up surveys. They do help us a great deal. The first survey will be sent directly following today's webinar. Sometimes they do end up in junk mail, so I'd ask you to check there. Otherwise, you can also see that the survey link right now is posted in the chat pod on the left-hand side if you'd like to copy that out for future reference, or in case you do have had issues in the past receiving that survey. That survey is how you will be able to request certificates for today's webinar as well as CEUs. Our surveys close in about 2 weeks, and so after that it will take about 4 to 6 weeks for us to manually create all of the certificates and get those emailed out to you, as well as that CEU form. That form, once filled out, goes back to continuing ed at montana.edu and not to the Rural Safety Center. It is done through a different department at Montana State University. However, it is free for you. You can also request a verification of completion form, which you can see here in the bottom right-hand corner. When you do request one of those from the Continuing Education Department at Montana State, it will list all webinars that you have ever filled out that form for, as well as all of our summits that you've also requested any CEUs for. Today we are grateful to have Dr. Wes Kumfer here to speak with us. He is an engineering research associate at UNC Highway Safety Research Center. He joined them in 2017 as a postdoctoral research associate with a focus on crash analysis and safety education. His primary research interest is traffic safety management through a system-oriented approach. While at HSRC, Dr. Kumfer has worked on pedestrian crash modeling, safe systems implementation, and engineering evaluation. He uses this experience as a member of the Road to Safety, Safe System, and Traffic Safety Culture Working Group, and as the research manager of the Collaborative Sciences Center for Road Safety. Today, the goal for our webinar is that once you've completed it, you'll have an understanding of a recently completed project examining traffic safety in the Appalachian region. And to achieve that goal, there will be 4 learning outcomes: to identify potential risks to rural road safety as identified in the literature, to characterize the traffic safety profile on the Appalachian region using crash data, to describe engineering methods used to improve safety and how to evaluate those methods, and lastly, to characterize rural road traffic safety culture using crash data. And at this time, I'm very pleased to bring you Dr. Wes Kumfer.
Thank you so much, Jamie. Can everyone hear me?
Yep, you sound great.
Great. Thank you so much, everyone, for attending. Looks like we have quite a few participants. I noticed some friends here from North Carolina, as well as some of the representatives of the Appalachian Regional Commission who sponsored this research. So thank you, everyone, for being here. And thank you again for that introduction. So what I'm going to be walking through today are the many steps of a recently completed project examining traffic safety throughout the Appalachian region. The Appalachian region consists of parts of 12 states plus one entire state. So you can see there that all of West Virginia is in the Appalachian region, and the rest of the region extends from Alabama up to New York. So it is a pretty comprehensive region that more or less runs along the spine of the Appalachian Mountains, but encompasses quite a bit of a diverse geographic range. Parts of it are certainly characterized by large rural regions, mountainous and curved terrain, and these probably have an impact on traffic safety throughout the region. So we were tasked by ARC, the Appalachian Regional Commission, to characterize traffic safety in the region by looking at a number of different metrics. So we synthesized any existing literature that we could related to traffic safety and traffic safety culture. Excuse me. We examined the characteristics of traffic fatalities in Appalachia using data from the Fatality Analysis Reporting System. And one of the questions that we were asked to look at specifically was drug-impaired driving, but we looked at quite a few different measures. We also, excuse me, we also took a look at North Carolina and compared Appalachian counties in North Carolina to non-Appalachian counties to act as a case study. And then one thing that ARC was very interested in figuring out was whether or not the Appalachian Development Highway System, or the ADHS, has a positive impact on traffic safety. And so we synthesized all of these other components together into a series of findings, policy implications, and strategic recommendations. Today I'm going to be walking us through the different steps of this project and the findings that we generated from each task, but I'm going to be focusing the lens a bit on rural traffic safety culture and how the Appalachian region itself might be emblematic of specific rural traffic safety culture, and what else we probably need to know and study. So I should just give a shout out to some of my co-investigators, Dr. Raghavan Srinivasan and Mr. Arthur Goodwin, as well as the analysts, Dr. Katie Harmon, Dr. Bolan, Mike Vaughn, and Dr. Yudon Wong, as well as some project support from Chris Kamola-Mullen and Jonathan Weisenfeld. Okay, with that, I'm going to go ahead and move into the literature. So again, this was a systematic literature review to try to identify what has already been done in terms of traffic safety in the Appalachian region and what literature exists out there as far as traffic safety culture and what sort of crash characteristics pop up in this literature, especially as they relate to rural areas. And so we did a systematic search through electronic journal catalogs, things like TRID and PubMed. We did an extensive search into gray literature. So this would be research reports, publications, technical briefs, that kind of thing that comes out through the sponsor or AAA Foundation or the CDC. this not necessarily peer-reviewed journal publications, but other publications that might inform a bit more of our thinking around this topic. Then we also looked for any gaps that we could possibly identify. So in total, we indexed about 288 total references and included greater than 125 in the literature synthesis. And big picture findings, really, we didn't find much about traffic safety in Appalachia. We believe there's reason to think that this region is unique within the United States, but we couldn't find much within the actual literature to say so. However, we did find quite a bit of literature related to health disparities in Appalachia compared to the rest of the United States. And this literature seemed to indicate that Appalachia compares unfavorably to the rest of the United States for a variety of mortality reasons. And one of those hinted at were traffic crashes. So walking away from that sort of broad picture and this literature analysis that we did were some different gaps and questions that we wanted to try to answer. So things like, how does roadway geometry, specifically curvature, affect our roadway departures? How does the isolation of the Appalachian roadways interplay with roadway lighting and EMS access to affect severity? How dangerous are rural roads in Appalachia? What is the existing traffic safety culture in Appalachia? What poor driving behaviors are perpetuated by the existing traffic safety culture? And what other variables, maybe elements of this traffic safety culture that affect safety, but are really hard for us to pick out in crash data? So trying to answer those questions, those gaps, led us to a handful of different steps, and especially variables that we would try to look at in the fatality analysis and the North Carolina case study. But I'm also going to just briefly canvass a few of the highlights from the literature. So one of those being that if we look at the demographics throughout the region, and here I've just presented total population in the United States and the Appalachian region, and then the median age within the different subregions of Appalachia, as well as the number of people who live in the different designations, meaning metropolitan, rural, urban, so on and so forth, we find that Appalachia actually has a pretty significant rural population. 42% live within rural areas, and those who live in the urban areas often have to drive through rural areas. Now, this isn't to say that this is a uniform definition of rurality throughout the region. And in fact, I know there are a number of different ways that we can define rural designation. But we do want to just point out that a lot of Appalachia is rural, and many of the traffic safety issues may pop up within that rural region specifically. And so we think examining this rural traffic safety culture helps tell us a bit more about Appalachia as a whole. All right, so some of the different variables that popped out within the literature that we did find that relate to rural areas include long driving distances, lower population densities, high speed limits, hazardous roadway designs, poor clearance zones, and decreased access to emergency medical care. And sharing these results with our sponsors, many of these were of interest. We also examined the strategic highway safety plans of all 13 of the states that are included in the Appalachian region to see what they had to say about either regional issues or rural road safety. Excuse me, and what we found were roadway departures were connected to speeding and impaired driving, that aggressive driving, especially on horizontal curves where roadway lighting and signage may be poor, there's a need for improved EMS access, and there's a lack of data infrastructure for collecting and reporting quality data to allocate funding resources. And I do apologize for the coughing. I'm feeling a bit allergic today. I think it's just the change in weather is causing some congestion, so I apologize for that. Traffic safety culture literature, thinking about, just the general rural risks that I highlighted, and then some of those risks pointed out in the strategic highway safety plan. If we think about what traffic safety culture literature tries to focus on, it tends to be more behavioral elements, meaning how is it that people are interacting with the roadway, and what are the drivers of those behavioral factors? So things like distracted driving, speeding, impaired driving, drowsy driving, occupant protection, red light running, wrong way driving, and vehicle size choice. We'll see all of this pop up in traffic safety culture literature. And a lot of the literature focuses on, well, if we can understand these different variables, then perhaps we can understand the culture that is driving them. And one framework that is sometimes proposed, there are a lot of different frameworks out there for traffic safety culture, but one that relates specifically to rural traffic safety culture comes from Nick Ward. And he talks about how you have a rural community composed of demographics, personality, environment, and that this feeds into a specific culture of behavioral beliefs, normative beliefs, and control beliefs. These then influence things like your attitude, and they create norms. And these norms influence people's intentions to engage in a certain behavior. And what I mean by that is if you have a certain behavioral belief about, say, whether or not you need to buckle up when you're driving, if everyone shares this belief, then this creates something of a norm of people not buckling up when they drive. But then those who go to drive, they intend to not buckle up, and then this causes the behavior of not buckling up. That's just an example of how you might use this framework that Nick Ward proposed. It's not the only framework for traffic safety culture, and in fact, I'll try to get us to something of a different understanding of it. But this is one way that's often framed. What this definition, though, or that framework did lead us to was to propose something of a kind of a working definition, a sort of blank statement that we could try to fill in as we examine the crash statistics. So this would be traffic safety culture in Appalachia is the collective force of social norms, behaviors, and values that determine the average person's posture toward engaging or not engaging in road use behaviors that can influence safe or unsafe use of the unique roadway environments that characterize the region. Now, having read that, you're probably looking at it and thinking, well, that doesn't really tell me anything about traffic safety culture in Appalachia other than it is somehow embodied in the specific driver behaviors that may come out in roadway statistics. And I would agree with you. This doesn't really tell us much of anything. But we started with this framework and then tried to move in and fill in the pieces as we went. So with that, we are going to move on to our first poll question.
Perfect. Thank you so much. And again, we have come to our first question and answer spot. If you do have any questions for Wes, if you can put those over in the chat pod on the left-hand side. And our very first poll question for you is, which of the following characteristics of a rural road can increase the driver's risk of fatal or serious injury? Is it limited roadway lighting, increased distance from emergency medical services, sharp or poorly designed horizontal curves, limited roadside design, all of the above? And then we also, as you guys know, with the Rural Safety Center have challenges for you. And so our challenge for this section is, from this section of the webinar, what is one action item you'd consider implementing in your jurisdiction? If you want to jot that down for yourself, and if you're interested and willing, if you would put that also here in the challenge box, we'd love to know what some of those items are that you might consider implementing in your own jurisdiction. And we'll just give everyone a second or two here to fill out the polls. Okay. Wes, it does look like most people have had time to fill out the poll questions, so I've broadcast the results for you now.
Very good. Yes, I see that. And I see that most people, 96%, said all of the above. I would agree with that response. I would also say that those who said sharp or poorly designed horizontal curves, you're definitely capturing one of the many risks. But the literature does seem to show that roadway lighting is especially problematic in a lot of areas, and we'll see that come up in our later results. This sharp and poorly designed horizontal curves, we'll see horizontal curvature be an issue in the fatal crash data. And limited roadway designs, or roadside designs, meaning some language that used to be used would indicate roadside hazards or hazardous roadway designs. I know there's some pushback on that word hazard. But if you just talk about, well, limited shoulders, maybe steep drop-offs, other things that are unsafe in roadway design, or sorry, roadside design, those are also elements that can increase risk. So that's why I would say all of the above is correct. And I'm seeing some good results and answers here in the challenge. So folks talking about high friction surface treatment. I was actually, I think a week or two ago, talking to a consultant who was doing some work in Kentucky, and this was one of the elements they were examining on some of the ADHS corridors, this high friction surface treatment and whether or not having poor roadway friction can affect your safety in a rural area. So that was definitely something that came up. I see public outreach, fixing site distance issues, and curve marking. So the challenge responses seem to range from addressing roadway design to addressing culture as well. And that's one thing I'm really hoping you take away from this presentation. With that, I think we can go ahead and move on to our next step.
Correct. I don't see any questions for you in the chat pod, so I'm bringing up our presentation again. And
okay.
At this time, you can go ahead and move on to the second section. Thank you.
Yeah, thank you. All right, so this next step, we're going to be talking about, or I'm going to be talking about, sometimes I talk about myself in plural, we. I'm going to be talking about traffic fatalities and the North Carolina case study. So we looked at traffic fatalities in Appalachia from 2013 to 2017 total. And again, I do want to specify that the unit of measurement here is fatality, not fatal crashes. And so we were looking for fatalities that involved a motor vehicle that occurred on a public roadway. And that resulted in a death less than or equal to 30 days of when the crash occurred. Okay? And so we calculated frequencies, meaning counts of proportions. We calculated fatality rates and rate ratios, adjusted for age, sex, and urban, rural, county of crash. We also calculated odds ratios, and we looked at the Wald 95% confidence interval to test statistical significance. So we weren't just looking at how frequently things appear in the crash data or the fatality data, but rather what was statistically significant. And really, we wanted to answer these questions. So are there behavioral variables common to traffic fatalities in Appalachia, such as alcohol involvement or excessive speed, that can tell us about the traffic safety culture of the region? Are there differences between Appalachian subregions? Are there differences between rural and urban Appalachia? Again, that was something we thought would probably be important from the literature review, but we did want to test that. And are there differences between Appalachia and the rest of the United States? So I'm going to start off by showing a few different slides related to the different subregions of Appalachia. There are 5 subregions, and if we compare all of them, we see that the central region had a fatality rate nearly twice the northern region. Northern region being you get up into New York and Maine, whereas central region, we're looking at West Virginia and that area. And so we do see that there are differences between these different regions. We also see that across the different regions, a lot of the traffic fatalities are occurring in rural areas when compared to urban areas. This is most pronounced in central Appalachia, but it was something that we saw in all of the different regions, or subregions, I'm sorry. Looking at some of the different behavioral indicators, some of these things that may be indicative of traffic safety culture, we actually saw that across the regions, most of them did have some issues with not helmeting, but South Central region, this actually stands out, has universal motorcycle helmet laws, and that's why the odds ratio for South Central was so much lower, why they were actually more likely to be wearing helmets than not wearing helmets when engaged in a fatal crash. Similarly, we can look at speed and alcohol involvement and the odds ratios of whether or not fatalities that were involved in fatal crashes include high-speed involvement or alcohol involvement, and we do, again, see some differences between the different regions. Now, if we are comparing Appalachia and non-Appalachia, what we see is that adjusting the fatality rate for the Appalachian region, we see quite a bit higher than non-Appalachian region. And when I say non-Appalachian region, we were actually looking at the entire United States that is outside of the counties that are specifically designated as Appalachian counties. And so this figure did seem to indicate that adjusting this per 100,000 person years, that fatality rate in Appalachia was much higher. And we also saw, if we look at this over time, that fatality rate does seem to peak around October. This was one of the things that we actually did see in the literature review that may be an issue in Appalachia, were what some people might call the leaf peepers, people who travel to the region to look at leaves and the changing fall foliage during the fall season. I don't think that's a bad thing. I love the fall foliage here in North Carolina, and I think I was recently in Tennessee, and it is just lovely there in the Smoky Mountains this time of year. But it is worth considering how tourism can be affected by things like your changing seasons, and that tourism can then affect your traffic safety. And then if we look at just comparing Appalachia to non-Appalachia, some of these same variables that talked about between the different subregions, we see number of lanes was much more linked with Appalachia and non-Appalachia. Sorry, two-lane roadways were much higher incidence in Appalachia than non-Appalachia for being involved in traffic fatalities. More traffic fatalities occurred on curved roads in Appalachia than non-Appalachia. More traffic fatalities occurred on some grade in Appalachia than non-Appalachia. And in Appalachia, more traffic fatalities occurred with vehicles that were greater than 20 years old. So this was something that did stand out to us when comparing it to the rest of the U.S., that the vehicle fleet in Appalachia does seem to be older. A lack of restraint use was more problematic in Appalachian traffic fatalities, but some high spots here that we did see. Again, there was there was less use, less lack of helmets in Appalachia compared to non-Appalachia. There was just slightly less speed involvement and slightly less alcohol involvement. I think those last three things especially are some bright spots that we didn't expect to see based on our literature review, but may indicate that there could be some cultural elements at play that affect things like helmet use, that affect a behavior of speeding and affect a behavior or intention to drink alcohol and drive. Moving on to the drug and impaired driving, it's worth noting that FARS has a number of significant limitations. We did want to answer this question of what was drug and impaired driving involvement in traffic fatalities in Appalachia, but just want to caveat this with the FARS data is very, very limited, and it is difficult to draw broader conclusions based on the FARS data just because these data are collected from limited testing. Not all states test for the same drugs. Not all states report drugs the same. There are different classes of drugs that affect the body in different ways. There's a no-dose response curve relating the level of substance and level of impairments for most classes of drugs, meaning that while we understand how alcohol impairment to some degree affects traffic safety, we don't really understand what exactly constitutes impairment. FARS really only presents whether or not the drug was detected. It doesn't necessarily say whether the driver was impaired at the time. So all these caveats taken, meaning that what's in the FARS data only gives you a glimpse at what may be reality, and may say that, well, some of these drugs were present, but they weren't actually impacting safety. We did see that, just summarizing the different test results, that out of 25,259 Appalachian and 217,775 non-Appalachian motor vehicle drivers involved in fatal crashes, less than half had drug test results. And just looking at the negative toxicology screens, we saw actually less in Appalachia than in non-Appalachia, meaning more positive toxicology screens in Appalachia than non-Appalachia. But again, that was less than that 50%. And so that leads us to think that while there may be some drug use, it's probably not easy to extrapolate from these results into a broader traffic safety culture. But some things that we can maybe think about from our results is that fatality trends are different across these subregions. So individual subregions may vary from a broader regional traffic safety culture, meaning that even if we try to characterize the traffic safety culture of the Appalachian region, we may be missing elements of each of these subregions. Appalachia is clearly a unique region in the United States. We did see that for a lot of these different variables, there was a pronounced impact in Appalachia when compared to the rest of the United States. Many Appalachian traffic fatalities are more likely to occur on rural two-lane traffic ways with curves and grades. That was definitely something that stood out. Appalachia's traffic safety profile does have bright spots, and that's one of the things we wanted to highlight today, meaning that fatalities are less likely to be not helmeted and killed in crashes involving alcohol. And then if we look at how it is that we mapped all these, this is allocating our different county fatalities in total to the different counties within the Appalachian region compared to the rest of the region, and you'll see where they tend to cluster. And while there are certainly some clusters in urban areas, we do see quite a spread through rural areas as well. So moving on from the broader traffic fatalities analysis, looking at North Carolina specifically as a case study, we wanted to actually examine the proportion of fatal and injury crashes within all crashes in North Carolina. And so we extracted all crashes within North Carolina for Appalachian counties and non-Appalachian counties from 2013 to 2017, and then calculated the proportionate rates, again, meaning the rate of fatal and severe injuries out of total crashes. And then we, for select variables, calculated odds ratios using logistic regression. So just some highlights of things that we found in this part of the analysis. We also saw that fall peak. Now this is true for both Appalachian Region and non-Appalachian Region counties in North Carolina, but in both, we once again saw around September and October, you have the same sort of potentially tourist-driven, maybe some school-driven traffic as well. Seasonality does have an impact on traffic safety, and it's worth considering whenever you're trying to come up with project prioritization. We also saw the ambient light conditions vary between rural and urban within Appalachian counties in North Carolina. So while the majority of issues, the majority of darkness but lighted roadway crashes, fatal or serious injuries, those were in urban areas, we actually see more pronounced just darkness with roadway not lighted in the rural areas. And then we also see the lack of restraint use in our crashes comparing Appalachian and non-Appalachian counties, to where while they were pretty even for several years, at least within the last few years, the lack of restraint in Appalachian counties has been higher. And then we looked at vehicle age, and again, some of the same pattern of Appalachian counties having slightly older vehicle fleets than non-Appalachian counties. So summarizing all this together, we did see that severe crashes in Appalachia seem to peak in fall. There's a lack of roadway lighting within the Appalachian region, and this is a concern that sort of verified that finding from the literature review that roadway lighting may be an issue, especially in rural areas, and that there's a need for universal restraint laws. This is one that popped up in the fatality analysis as well as the literature review, just that we need to account for a lack of restraint use. But a question to consider from this result before I move into the next section is, are these traffic safety concerns embedded within the culture, and if so, can they be mitigated, perhaps by a change in organizational traffic safety culture? So with that, I think we're moving on to our next FAQ period. Sorry, Q&A, not FAQ.
No worries. Once again, we have come to a question and answer section. So if you do have any questions for Wes, if you put them over in the chat pod on the left-hand side. And while we're waiting to see if there are any questions, we do have another poll question for our audience. And that is, which of the following characteristics does not apply to fatal crash trends in Appalachia? Is it traffic fatalities are more likely to occur on two-lane roads in Appalachia than in the rest of the U.S.? Traffic fatalities are more likely to be killed in excessive speed-involved crashes in Appalachia than in the rest of the U.S. Traffic fatalities are less likely to be wearing a seatbelt in Appalachia than in the rest of the U.S. Traffic fatalities are less likely to be killed in alcohol-involved crashes in Appalachia than the rest of the U.S., or none of the above. And again, we would encourage you on our challenge for the Rural Safety Center, for this section of the webinar, what is one action item that you could consider implementing in your own jurisdiction? Again, if you want to jot that down where you are, and also if you're willing to share that, we'd love to see your answers in the open-ended challenge question as well. We'll just give everyone a few seconds, and then it does look like there are some questions coming in, so we'll address those right after the poll. Okay, it looks like at this point that everyone has answered, so I have broadcast the results for you, Wes.
Great. So this one was a bit of a trickier question. I do recognize that. But note that actually the somewhat counterintuitive finding was that there was just slightly less excessive fatalities involved in excessive speed-involved crashes in Appalachia than the United States. Again, that was a 29% versus 29.3% in the broader United States. The rest of these are true, that traffic fatalities are more likely to occur on two-lane roadways in Appalachia, and that traffic fatalities were less likely to be wearing a seatbelt. Both of those are true, as is that traffic fatalities were less likely to be killed in an alcohol-involved crash. So a little bit of a tricky wording there, but I think most people, or there was a plurality that responded correctly there. And again, oh, go ahead.
Sorry, go ahead.
Oh, I was just going to say, looking at your challenge answers, again, I see some lighting, tree removal on outside of curves. I think that's important. Lots of emphasis on lighting, though.
So we do have several questions that came in for you. The first one is, were you able to incorporate the idea of exposure in your analyses?
Very good question. So the question of exposure, we did not incorporate that in looking at traffic fatalities because FARS doesn't really have exposure. We did try to calculate rates by population, but I will say in the next session I'm going to present on, which is an evaluation of the Appalachian Development Highway System as a type of treatment, that we did actually have traffic volumes in that. So we did account for exposure in that part of the analysis.
The next question we had for you is, did you consider the increases in crashes in the fall could be due to seasonal wildlife migrations?
That is a good question. So were seasonal wildlife patterns responsible for some of the crash patterns we see for fall? We did not include that in our analysis. It was something that the literature didn't lead us to believe would be a large and significant variable, and we weren't trying to, say, do a fishing expedition for every possible explanatory variable, so we did not include it. But I do know that here in North Carolina, animal crashes or animal-related crashes do actually tend to be problematic, and I know in some of the other states they can also be as well, so that may be something that we would want to look at. I'd be interested to know if, because I don't know it off the top of my head, to be honest with you, if anyone has done any evaluations of the safety benefits of animal-specific infrastructure. Like I've seen pictures of, say, elk underpasses or things like that. I'm just curious if anyone has done any type of safety evaluations of those. I'd like to know the results, to know if that is an effective treatment.
And for that one, I can let you know that the WTI has done some of those types of evaluations, and so we can pass some of that along to you, Wes. And we did have last October, we had Rob Emmett from WTI presented on what some of those different countermeasures could be, so I'll send that along as well. But for anyone else interested in that same information, that webinar from last October 2019 is available on our archived webinar page on the Rural Safety Center website. Our last question for you, Wes, is from what you presented and mentioned, there seems to be significant differences between the regions. Since AR fatalities differed than the rest of FARS fatalities, do you think a couple of regions greatly sway those results?
So the question being, is it possible that some of the different subregions have an undue influence on the rest of the entire region? And I would say, yes, I do think that probably it's worth examining each of the subregions individually. And that's why, at least in the reports, which I've only taken some of the results from the report, we do talk about these subregions individually. I think it would probably be worth investigating each of them themselves. And I will say we also saw a pattern where some of the states had quite a few more crashes within the sample that we used to develop our model in the next section that I'm going to present. And so, yes, I do think safety performance does vary from state to state, and this could be due to a variety of factors. It could be due to, vehicle miles of travel within those states. It could be due to, available funding for roadway improvements, whether or not there are certain safety cultures, to get back to the topic of the presentation, that I don't think that you can call all of Appalachia a monolithic culture. And that is something I'm trying to convey throughout this presentation, and I'll kind of get back to that. Each of these subregions does have its own sort of character, and probably each of the states has its own character. But in looking at all of the subregions together, so within the broader region, we can kind of arrive at a bit of a picture of rural areas. But I guess to circle back around to my response, yes, I do think that different subregions in different states do have different influences on traffic safety without the region, and a good follow-up project to this one would be to model those subregion differences more thoroughly than we did here.
And Wes, it looks like that's the end of the questions for this section, and I've pulled the PowerPoint back up if you'd like to head on to the third section. Great.
So in this section, I'm going to talk about an engineering method that is commonly used to improve safety throughout the Appalachian region, and I'll also address some other countermeasures that can be used for other roadway hazards. But I'm going to be focusing specifically on how you might evaluate this kind of engineering treatment, because this was a rather interesting question for us to try to answer. So for this analysis, this part of the project, we looked at, sorry, it jumped ahead just slightly. We gathered crashes of all severities from 6 different states. I would say we started with a framework that was provided to us by ARC with different corridors that had been upgraded as part of their Appalachian Development Highway System. And so we started out with a broader sample of states and ended up with a sample of only 6 states. This was due to an inability to actually get crash data from some of the different states. There were some data use agreement issues and other things that limited our sample a bit. So that's why we only had 6 states. But we did look at all crashes and severities on Appalachian Development Highway System corridors and compare those to reference corridors. So in total, we had 13 treatment corridors and 40 reference corridors, and we looked at crashes from approximately 2001 to 2018. We chose these dates to try to capture the potential treatment period for when roadways are upgraded to the ADHS, but because construction periods vary, that's why we had some differences in the number of crash years available for different corridors. So I'm getting a little bit ahead of myself. I'll explain what I mean by treatment and what the ADHS is here in a second. I just wanted to point out some of the methods that we used. When I talk about the crash types that we extracted, we looked at total crashes, injury crashes, multi-vehicle crashes, single vehicle crashes, and night crashes. We also calculated the rate per million vehicles, and we looked at predicted crashes based on a safety performance function, and then we used that to calculate a crash modification factor. Ultimately, that CMF result was what we wanted to provide to ARC, meaning if you upgrade a roadway to the ADHS designation, what is the crash modification factor for these different crash types? So again, to reiterate some of what we've talked about so far, these different behavioral types of issues that we saw within the traffic fatalities and in the North Carolina case study of things like lack of restraint use or speeding, these are things that you might be able to address to some degree with what you might call behavioral countermeasures. So things like universal seatbelt laws can actually be effective. Or as we saw with Southeast region, universal helmet laws can be effective as well. However, there are some things that you can actually address just through roadway design. And I would even say speeding to a degree, sorry, not speeding, I should be careful with the way I phrase that. The kinetic energy that results from speed can be affected by roadway design. So if you have a roadway design with high visual friction, that can induce drivers to slow down. And so there are different things that you can do in your roadway design that can affect safety. And what we were really focusing on as part of the ADHS treatment would be things like whether or not crashes are occurring on two-lane roads or curved and graded roadways. There are countermeasures that can be applied to low light conditions. We only looked at nighttime crashes and whether or not the ADHS addressed those. But there are other suites that you can use for low light conditions or nighttime crashes. And all this to again say that the engineering treatment that we really wanted to focus on was this Appalachian Development Highway System upgrade. So to explain what I mean by that, throughout the Appalachian region, there are these corridors that are part of your Appalachian Development Highway System. And these corridors can be upgraded from what we termed an old alignment, which was typically a two-lane undivided corridor with minimal shoulders and often about a 35 to 55 mile per hour speed limit, although this varied from corridor to corridor. These can be upgraded to a largely four-lane divided with a wider shoulder, 55 mile per hour generally speed limit roadway. And so this can actually happen in one of two ways. And this is where some of the interesting question about this project really came from, is how is it that you approach a treatment that is really a suite of treatments? Now, for those of you who have used the Highway Safety Manual, one way that you might have approached this problem would be to look at, okay, what is the crash modification factor for, say, adding additional lanes? What is the crash modification factor for widening a shoulder? What is the crash modification factor for adding access control? And then you might multiply all those factors together and multiply that by your safety performance function to arrive at a predicted crashes. But that's not the way that we wanted to approach this question, because it wasn't that only one of these treatments was being applied at a time to the specific roadway. It was rather that, typically speaking, all of these different treatments were applied at the same time, meaning this was essentially a package deal. And this could be done in one of two ways. One being that a two-lane roadway would have a brand new roadway that was constructed nearby it to serve as a bypass, and this bypass now has a designation as being an ADHS corridor. The other way that it could happen is actually that that two-lane roadway itself is fully upgraded into a new alignment. So whenever we looked at these ADHS corridors and ADHS treatments as improved alignments or new alignments, we had to somehow try to answer this question of what is the safety effect of the ADHS when we consider that it applies to both upgrades and to just building a new bypass. It's a really interesting question, in my opinion, from a traffic safety management perspective. And so this is where we tried to think of what would be the best way to analyze this, to develop a CMF for that type of treatment. We could try to break it out into individual CMFs for the new alignment and the improved alignment, but we found that we didn't quite have the sample to do that. We tried to potentially do this as a before-after type evaluation, but unfortunately, again, just with the long range of construction periods that happened, we had to actually throw out a lot of the data to make sure that it wasn't unduly influenced by the construction period, and so we had some limited data for the before period or the after period. In some cases, this construction may have only been finished for a year or two, which is not always sufficient for determining an after effect. And so we really needed to kind of group these two these improvements together into a single type of upgrade. We also try to consider, okay, how do we think traffic moves as it is going across this new type of designation? When we're trying to account for changes in traffic flow, do we consider in our modeling that the traffic that is on both the improved alignment and the old alignment, in the case that the old alignment is still there, does that constitute an after period compared to only traffic on the old roadway? Or should we only look at traffic on the new alignment itself compared to the old alignment? Meaning it's a question of how systemic do we want to be in this? And ultimately what we decided to do is calculate a CMF corresponding to a systemic comparison of the new and old alignment. Meaning that for our after period, we were looking at traffic volumes on both the old roadways and the new roadways compared to just the old roadways. So just to give you a bit of a summary of our sample here, this is not including our reference corridors. We had about 3,000 crashes on reference corridors, and that was just to give us a sense of what the crash performance would be on these mostly two-lane undivided roadways that were similar to the ones that were being treated with the ADHS upgrade. And so what you'll actually see if you just eyeball these numbers is that it kind of looks like the safety performance was about the same between the before period and the after period, whether talking about improved alignment or new alignment. However, this does raise that question that we had about whether or not you approach this systemically. Because if you're looking at the number of crashes that are on both the new alignment and old alignment in the after period compared to just the old alignment in the before period, then your traffic volumes are going to be much closer to each other, and you may end up at a different crash rate. So approaching that, we did calculate these crash rates, and so that's why, again, taking this, this sort of systemic view into practice for our analysis, we saw that the crash rate improved pretty much for all of these crash types when looking at the new alignment versus the old alignment. And again, by new here, I'm talking about this after period of it being a systemic roadway where we're including traffic on both the old roadways, the improved roadways, and the new roadways compared to the old roadways. And so we see that for pretty much every single one of these crash types, that the rate was improved. However, what we wanted to know is actually the crash modification factor, which we ended up calculating by calculating a safety performance function for this ADHS treatment and then using the coefficient of the treatment to account for the CMF. And what we found were statistically significant results related to total crashes, injury crashes, and multi-vehicle crashes. And within the standard error, it does show that the ADHS improves those three crash types. We did not find any statistically significant benefit in our results for single vehicle crashes and nighttime crashes. That doesn't mean that there was a benefit, just that our sample didn't have, I guess, the statistical power to actually predict a benefit. If we look at the crash rates, we do see that those seem to show a benefit here, just couldn't prove it with the CMF. But what we do see, I think, is really interesting. So total crashes dropped, injury crashes dropped. Those two I would have probably expected. The multi-vehicle crashes, I think, is very interesting because you might think, okay, if I add lanes to a roadway, then I'm probably going to actually get more crashes or more multi-vehicle crashes because there might be more people, driving in separate lanes and colliding with each other versus single vehicle crashes. But that's not actually what we found. And we think if I were to hypothesize this, it would take more study. It would be that multi-vehicle crashes at the current traffic volumes that we analyzed, there just isn't a lot of, I guess, reason for people to collide with each other on the new roadways now that there are multiple lanes. So just taking all these things into account, we see that the ADHS treatment improves safety performance for most crash types at locations by addressing the geometric design. We did see that there were changes in travel patterns and vehicular volumes that may affect the efficacy of these over time. This CMF, again, is based on the traffic data that we collected, but if your ADP values do change over time, it may influence those numbers. And one thing I do want to point out, again, reflecting on traffic safety culture and some of these other values like the tourist patterns that we saw and the seasonality, is that this treatment doesn't take into account needs of pedestrians and bicyclists just by its nature. What we're really looking at are rural, typically rural highway upgrades, and that these are bypassing cities. Now, if we were to try to think about, okay, would we need to account for pedestrians and bicyclists? In the locations where these upgrades are typically done, it doesn't seem so. But maybe as population densities change, as travel patterns change, this may be something to consider in the future, especially if we want to prioritize things like local development and people just driving less. And I want to bring up a slide. This is actually from our fatality analysis, but going back to just who is involved in crashes, we actually see a lower incidence in Appalachia of pedestrian and bicyclist fatalities compared to non-Appalachia. I don't know, based on these numbers, if this is just to a lack of pedestrian bicycle traffic in Appalachia or if it's due to just less crashes actually happening. But these numbers, again, may indicate that there are changing traffic patterns that maybe need to be accounted for when it comes to walking and biking. And we need to consider these numbers whenever we are looking at treatments like the ADHS. Okay, with that, I think we can move on to the Q&A and the poll.
And once again, I've seen a few questions coming in over there on the chat pod already, but if anyone has any others, please add those in as we do the next poll break for y'all. Our next question is, based on the developed CMF, which of the following crash types can be reduced by upgrading an undivided 2-lane road to a divided 4-lane road? Injury crashes, nighttime crashes, single vehicle crashes, speeding-related crashes, all of the above. And we'll give everyone just a few minutes to go ahead and fill that out. And again, with that challenge question from this section of the webinar, what's one action item you'd consider implementing in your jurisdiction based on what you heard? If you're willing to share that, we'd love to see it again in that open-ended pod. All right, and I have closed the poll, Wes, and it looks like just about everyone has gone ahead and answered, so I broadcast those results for you.
Very good. So we did see all of the above. Most people actually responded that. But based on our CMF, so based specifically on our CMF study, we actually can't really conclude much about nighttime crashes and single vehicle crashes. And speeding-related crashes were not ones that we examined specifically in this particular CMF. So the one we were looking at were injury crashes. Now, it's possible that nighttime crashes and single vehicle crashes were affected, and the crash rates indicated that that may be true, but at least based on our CMF results, we could not make that conclusion. So injury crashes would have been the right answer there. Okay, I see safety edge as a challenge that someone wants to undertake. This is definitely something that we saw in the literature that a lot of people apply. It's one way to improve your roadside hazard rating, and it's something I think FHW even calls one of their approved treatments, or their suggested treatments. And then adding better treated shoulders, that popped in as well. Another one said safety edge. Changing how safety evaluation is done for considering the impact of changing. I can't quite catch all of what that last answer is. Cut off for me.
For me as well, I'm unable to see it too at the scrolling bar.
Okay.
So I'm going to ask you one of the second sets of questions. The first one is referring to a specific slide. So while you're answering the second one, I will go back to the slide deck and see if I can pull up that slide for you to make it a little bit easier to answer. So the second question is, were rumble strips in both the old and new alignment?
We don't have the data to answer that. As far as I can tell, rumble strips probably were included in the new alignment as well. Just don't have the data within the data that we received from the DOTs and the different websites to indicate whether or not rumble strips were on the old alignment. It would certainly be something that would be interesting to look at if we were to reconsider this question, considering a few different design elements.
So I believe I've pulled up the correct slide, but if I ask the question and it doesn't seem right, please let me know and we can move the slides back and forth. But it says, are the results on slide 54 for a combined treatment of widening, improving, and building new?
I think this might be the right one. So this is the CMS for just the ADHS treatment. So I will answer this question as if this is the slide in question. I think it is. Yes, so this CMF applies to the ADHS treatment itself. And in this case, we consider the ADHS treatment to include both the brand new alignments, meaning the new roads that were constructed to the ADHS standard, or the upgraded alignments that were constructed to the ADHS standard over the old roadway. And the reason why we approached it, again, to reiterate my explanation earlier in case it wasn't clear, is that we needed a sufficient sample size to evaluate this ADHS treatment, and because we wanted to tell our sponsors and ARC that they could share these results with their DOT sponsors throughout the region, whether or not either building a new roadway or upgrading a roadway to this ADHS designation would provide a safety benefit. And part of this is that there may be funding available for prioritizing these kinds of upgrades. So the results of this CMF do take into account this sort of combined treatment approach. It's a suite that could be either an upgrade to a new alignment or old alignment, or a brand new roadway. If I'm not mistaken, we did, in the process of doing model development, try to look at the two separately, meaning we did try to examine just the new alignments to the old alignments and then the upgraded alignments to the old alignments, but just could not find as much within our statistically significant results to say one way or the other. And so we did group these together into a single treatment. With a greater sample, you could probably do this evaluation and look at them differently. It would require a lot of data collection to do that, but it would, I think, be a worthwhile next step.
Okay, and it looks like that was our final question for this section, so we're all set for section 4.
All right, thank you very much. So in this section, I'm going to try to circle back to everything that I've talked about so far and see if we can characterize rural road traffic safety culture using our crash data and the results of these different analyses together. And so synthesizing everything, what we know now is that the traffic safety profile of the Appalachian region is unique when compared to the rest of the United States. The literature indicates that some of Appalachia's uniqueness is due to its rural expanses and population distribution. We did see that some of the factors related to the rural nature of the region, such as location of crashes, again, those two-lane roadways, the curvature, and the time of crashes, meaning the seasonality and some of the nighttime or low lighting conditions, contribute to the uniqueness of the region's traffic safety profile. And so all this together led us to try to think, okay, what would a refined definition be of that first version of the traffic safety culture definition I proposed for Appalachia? And that is, traffic safety culture in Appalachia is the collective force of social norms, behaviors, and values that determine the average person's posture toward engaging in positive road user behaviors, like helmet use or not drinking and driving, or negative road use behaviors like not wearing restraints, while navigating older, on average, vehicles on frequently rural roadways, often characterized by two-lane curved alignments with minimal lighting. So I think this is a little bit of a better definition. It does account for some of the specific patterns that we saw both in the traffic fatalities and in the case study in North Carolina and some of the other things that were done. However, is the definition sufficient? That's our question. And honestly, I would say probably not. While we can say more about the kinds of crashes that involve Appalachian drivers, and we can speculate about the rural attitudes broadly, or the Appalachian attitudes specifically that inform them, I think we need to study regional values to arrive at a more precise definition. Sorry, it looks like that last bullet did not appear. And that is that we also need to account for the organizational culture of agencies in Appalachia that influence safety. And this is really where some of the literature review and recommendations in our final report went, is this organizational culture. What are things that we can tell DOTs to prioritize? What are things that we could tell ARC to help their partners focus on? What organizational changes need to be made to make some of these positive values really highlighted? And even what are some values that Appalachian residents or rural residents share that can be activated? So more generally, just based on the results of the study, we can say things like, yes, we need to improve roadway lighting. We need to consider tourist destinations project prioritization. Or, as the question previously pointed out, maybe even think about if you have travel or animal migration patterns in certain areas that need to be mitigated, right? We can also recommend implementing the ADHS treatment on old two-lane corridors, if traffic will remain stable. And we can try to implement other countermeasures for single vehicle crashes along ADHS alignment. I do think this is an important point since we couldn't find a statistically significant CMF for those single vehicle crashes. But related to organizational safety culture, some things that we would recommend include more research that is needed to characterize the traffic safety culture of Appalachia. Again, we found a large gap in the body of literature, so more studies specifically for Appalachia need to be done. We need to consider Appalachia needs in state strategic highway safety plans. I will point out that having read through every single one of the Appalachian state strategic highway safety plans, that Appalachian specific needs were never highlighted. It's not something that is currently being thought about too much. We may also want to think about how it is that we can prioritize safer vehicles. We did note again that median age of vehicles in Appalachia is older, and a lot of older vehicles just don't have as many safety features. So this could be something of activating people's values around protecting their loved ones, right? A desire to want to keep your family safe without necessarily buying very expensive vehicles that are going to, say, increase the kinetic energy on the roadway. And then also things like social marketing programs. These have been demonstrated, especially in rural areas. I think Clackamas County in Washington, has been undergoing a Road to Zero project to try to use social marketing to influence safety. It may be a way to target things like a lack of restraint use. Oregon, oh, thanks, Rob. I appreciate you chiming in there. I knew it was one of the two, but I was bound to get it wrong. And so social marketing programs are something that can be used. One thing that folks at the Highway Safety Research Center here are currently working with, I think it's Pearson County, and that's saying most of us buckle up. The idea being that, well, we're at like 90% restraint use in this county. It's hard to get that last 10%, so we're trying to activate this place-based identity. And I would also, again, just note, improved drug testing data is needed to understand drug use and its relation to driving while impaired, so systemic solutions can be implemented. And I say all that to kind of note that FARS data doesn't tell us quite enough to understand the incidence of drug-impaired driving, and what we really need is better data. And if we have better data, we may understand why people are, say, if it is a problem, why people are taking drugs and driving and becoming impaired. It could be things like maybe there are systemic issues within specific counties or within specific regions that are driving consumption of certain drugs. Maybe a lot of workers are injured. Maybe there's an older population. Maybe there are other cultural elements at play. Right now, we just don't have the data to really say more about it, but I think it's something that if we do get more data, we can start to address this from a cultural perspective. And again, I just want to try to summarize these three things into, rather than a broader framework that just kind of looks at what crash data tells us, I've lately been thinking about how it is that we can approach values within traffic safety culture, especially in a rural culture. How can we actually appeal to this idea of people really having a lot of pride of living in a rural area, of appreciating where they live, and having strong traditions and roots, and a large emphasis on family, and a large emphasis on stability? How can we activate good, positive values that are present in rural regions to address some of the traffic safety problems that we're seeing? I'm sorry, the animations are being a little wonky, but I would say things like activating the same values responsible for that lower incidence of speeding and alcohol impaired driving. If we can do studies to try to figure out why are less people speeding, why are less people drinking and driving, what are these positive values that are associated with that? Maybe your rural culture is one that really values benevolence and wants to universalize that. Maybe we can tap into that. Instilling a place-based identity linked to safe driving behaviors. This is reminiscent of that point I just made, but maybe things like having your DOTs or your local government say things like, Appalachians care about their loved ones and they buckle up. This could help instill a place-based identity that makes people want to be more cognizant of their driving behaviors, the attitudes they adopt, and even whether or not they're willing to drive instead of walking or biking. And then prioritizing local engagement rather than pass-through travel. You know, I know a lot of the purpose of highway development is to facilitate fast travel, to help develop economies, but I think we saw that there is a lot of patterns, especially within the fall regions of travel change. And so maybe worth considering how can we, as we're trying to economically develop, how can we engage with local partners to also make sure that pedestrians and bicyclists are safe, to make sure that people are using their roadways safely within their specific counties or regions or jurisdictions? How can we prioritize how can we prioritize local development so that we're not adding more and more and more and more traffic onto the ADHS system that might change the safety of the system? Just some things to consider. And with that, I am going to go to our final poll, and then we can wrap up with a Q&A.
And so as Wes mentioned, this is our last question and answer section. So if you do have any final questions, please put those on the chat pod over on the left-hand side. Our final poll question for you is, which of the following recommendations from our study do you think is most related to a change in traffic safety culture? Is it state DOTs evaluating and revising roadway lighting programs, local governments implementing economic development programs to bring newer vehicles into the fleet, public health departments enacting social marketing to address lack of restraint use throughout the region, or state DOT prioritization of rural road safety needs in funding allocations? And lastly, we would ask you again the challenge from this section of the webinar. What is one action item you'd consider implementing in your jurisdiction? We'll give everyone just a few seconds here to fill out the poll questions, and then we'll go to any questions over in the chat pod. Okay, Wes, I have gone ahead and closed the poll and broadcast the results for you.
Very good. So there were no correct answers, or sorry, there were no wrong answers, I should say, to this poll. I was genuinely just interested in what the respondents thought. So I saw one vote for local governments implementing economic development programs to bring newer vehicles into the fleet. That was something we talked about, and an interesting cultural artifact that I highlighted related to the Appalachian region was just the older age of vehicles that we saw in traffic fatalities. Saw 13 votes for public health departments enacting social marketing to address lack of restraint use. Again, that was something that we saw being an issue, that lack of restraint use. And it's something that we have seen in the literature as being one way to approach that. And then state DOT prioritization of rural road safety needs and funding allocations. I think this continues to be an issue. Pretty much every state talks about their hazardous rural roads in their strategic highway safety plans, and so it's something that needs to continue to be considered. So with that, I see some challenge questions of things like marketing programs, installation of recessed reflective pavement markers. I'll be very interested to hear more about this reflective pavement markers. I've been involved in an NCHRP project trying to actually gather literature related to the efficacy of those based on an older NCHRP project. So just would be interested to know, whoever responded that, what they're finding about RPMs. Marketing campaign of don't drive like a tourist. I like that one. Considering local needs, local culture more in marketing programs. Again, I think you can keep building up your safety in your local jurisdiction and sort of making sure that jobs are available so that highways aren't overwhelmed. Setting aside more money for safety upgrades and examining best practices. So lots of good responses there.
And we do have one question for you, Wes. That is, from your study and the Road to Zero grant, I have learned that FARS doesn't appear to be an accurate source of data to evaluate racial disparities. Do you agree, and do you have any data source suggestions for those interested in digging deeper into this issue?
Very good question. I would agree with that FARS data is probably insufficient for looking at racial disparities. There are demographic variables in FARS. In fact, in our final reports, we do have some summary slides, summary tables related to the racial breakdown of the different subregions of the Appalachian region and how those are involved in traffic crashes or traffic fatalities. But that really only tells you about who is involved, right? It doesn't tell you whether or not there are equity concerns or other racial disparities that need to be accounted for. An example of that might be, is there safe infrastructure in predominantly black neighborhoods? That may be a sort of racial disparity question that FARS would be insufficient for answering. Some data sets that I have started to see, obviously some folks will include Census Bureau information about, say, block level or TAZ level racial data so that they can use that as a surrogate measure for exposure. So let's say that you're trying to model pedestrian crashes and you want to know what are racial disparities in pedestrian crashes. You may highlight by looking at Census Bureau data, where these crashes tend to cluster and maybe consider things like, the median income of that region or what sort of facilities are available in that region, how accessible are sidewalks. Another one that I recently saw for North Carolina specifically was a public health list of NC economic indicators or health disparity indicators, and there may be other states that have a similar list. Brian, if you email me, I can try to send that to you after this presentation if you're interested.
And someone, Wes, it looks like is also mentioning that yes to the health opportunity indices that you mentioned as well.
Great. Thanks, Eric.
So I'm going to go ahead and wrap up this webinar. And if we do have, it looks like we may have a final question coming in, so I will go back to that if it does come through. In today's webinar, we hope you have learned to identify the potential risks to rural road safety as identified in the literature, to characterize the traffic safety profile of the Appalachian region using crash data, to describe engineering methods used to improve safety and how to evaluate those methods, and to characterize rural road traffic safety culture using crash data. I do want to mention for upcoming webinars, there is the last forward webinar of the series will be held December 17th of 2020. There will not be one held in November. We are working on the next Safety Center webinar, so keep your eye out on your email for that. It's unclear if that will be held either in November or December currently. And as always, we do have our archived webinars available on our website. If you use the training drop-down, there is an archived page. This one will be up there within a week, and the ones that we had talked about before, such as last year's animal countermeasures one, are all available. If you do have any final questions, think of anything after the fact, you can reach Wes at the email listed on the screen, as well as myself for the Safety Center. You can reach us either through my personal email or through the info@ruralsafetycenter.org. And I do want to thank Wes one more time. That was a fantastic presentation, and we do appreciate you coming and speaking about all that's going on in the Appalachian Region Commission. So thank you so much for that.
Thank you, and thank you for allowing me to be here.
Thanks. Everybody have a great afternoon. Thank you so much.